When a tooth is damaged, whether by cavities or fractures, there are few options to repair it, and one of the most common is the dental crown. But is there a treatment that requires less tooth reduction than a crown, and that can give our teeth a longer lifespan? Let's take a look. Dental crowns are a treatment that normally requires a significant amount of tooth reduction. Practically half of the enamel is removed when making a dental crown. However, when the tooth is very damaged, it's usually the only treatment available to help us save a tooth. And by saving it, I mean not extracting it from the mouth. Now, just as there are levels of tooth destruction from cavities or trauma, there are also different types of treatments that correspond to that destruction. So, what treatment can help us save those teeth that are damaged but don't warrant the reduction of a crown? I present to you dental inlays. For many years, we dentists have tried to repair our patients' teeth with the least amount of damage and reduction possible. It's called minimally invasive dentistry for a reason, reducing the least amount of tooth possible and managing to repair it. Fortunately, new materials and their characteristics have allowed us to develop minimal tooth reduction strategies. Inlays used to be made of metal. It was the only option. They work very well. However, they aren't aesthetic at all, and the cements that bond the inlay to the tooth have improved considerably. New techniques allow us to bond resin, porcelain, or lithium disilicate inlays to the tooth, which can stay in the mouth for many years, but with the advantage that they're aesthetic and require less tooth reduction. The dentist, based on their experience and the type of cavity the tooth has, is the one who must choose which type of material is best for the patient. Obviously, if the patient is a 6'6" man with a very strong jaw, maybe a resin inlay isn't the most suitable, and he might lean more toward one made of metal or porcelain. While if, for example, the patient is a small woman with a jaw muscle that doesn't apply as much force, a porcelain or resin one could work perfectly. Besides the physical characteristics of the patients, there are signs and protocols that lead us to the correct selection of the material and, of course, the way the dentist reduces the tooth to shape this inlay. It sounds contradictory that to repair a tooth, you have to reduce it. However, this part is the key for an inlay to work. When a tooth is broken, whether by a cavity or a fracture, that missing structure has to be replaced. As you can see on the screen, if we wanted to put a piece of porcelain on that tooth, it's not possible because it has undercuts or pieces of enamel that don't allow the inlay to seat. After removing or shaving them down, we create the ideal situation so that the piece can go down and stay in its place. That is why the tooth is shaved out. We call it dental preparation, and doing it correctly helps the piece settle into your tooth and makes it last longer. Now, why do inlays sometimes come loose? Let's imagine a case where the dentist shaves the walls down at too much of an angle. Notice how there's practically no retention. It's very easy for an inlay like that to fall out. On the other hand, with straighter walls, it's much harder for the inlay to come loose. Sometimes we don't have much choice because the tooth is worn down and has few walls, but thanks to new materials, we can rely a bit more on the cement's adhesion, which lets us glue the inlay and not just rely on the tooth walls. This is a clear advantage of porcelain and lithium disilicate inlays over metal ones, which don't have the same adhesion to the tooth. Now, what advantages do inlays have over dental crowns? The main advantage that dental inlays have over crowns is that there is less shaving involved. In an inlay, much of the remaining enamel or dentin is preserved, that is, what's left of the tooth. For example, let's imagine a tooth with a lot of decay where we have to remove part of the center of the tooth that's infected and we're only left with the walls. What's best to do for this tooth? A crown or an inlay? If we think about doing a crown, we have to shave down all the walls to surround the tooth with porcelain. But if in this case we no longer have the center of the tooth, only the walls, then we'd be left with no tooth by making a crown. So in these and many other cases, inlays are the ideal option. Enamel and dentin are amazing structures that we haven't been able to match with any material, as they are very strong but at the same time flexible, especially enamel. So if we can preserve the remaining enamel, it will always phenomenal. The key here is knowing when an inlay can and can't be done. Sometimes the tooth to be restored is so damaged that an inlay can't work correctly and it fractures, so the treatment of choice is a crown. Both the inlay and the crown are wonderful treatments that, when well selected and executed, can work for many years and give the patient the chance to keep their tooth longer. This treatment can be performed by a general dentist or a specialist in prosthetics or dental rehabilitation. If you have any questions, leave them in the comments. Subscribe to the channel if you like these kinds of videos that are free and can greatly benefit your health. See you on Instagram at Dr. Federico Bay and I'll see you in the next video. Take care, everyone.